Are you a breastfeeding mother who needs to take Xanax? In this video, I'm going to give you expert advice on how to safely breastfeed while taking Xanax. 1. What is Xanax, and why might nursing mothers need to take it? Xanax alprazolam is a benzodiazepine that belongs to the class of drugs called central nervous system depressants. It is prescribed for the treatment of anxiety, panic disorder, and depression. Nursing mothers may need to take Xanax when they experience particularly severe episodes of these conditions. 2. How can breastfeeding mothers ensure their baby's safety while taking Xanax? It is important for breastfeeding mothers to be aware of the dosage and duration of Xanax they are taking, as well as any potential side effects it may have on their babies. Mothers should talk to their doctors about any questions or concerns before taking Xanax while breastfeeding. Breastfeeding mothers should not take more than 4 milligrams per day of Xanax unless otherwise instructed by their doctor. If a mother is prescribed a higher dose, she should breastfeed her baby immediately before and several hours after taking the medication in order to minimize the amount that passes into her milk. It is also important for mothers to take extra care when handling the pill form of Xanax, as crushing them could potentially lead to accidental ingestion by the baby. 3. Are there any risks associated with taking Xanax while breastfeeding? Yes, there are risks associated with taking Xanax while breastfeeding. In general, benzodiazepines like Xanax can pass into breast milk and can potentially be harmful to the nursing baby. The U.S. Food and Drug Administration (FDA) has classified Xanax as a pregnancy Category D drug, which means that it could cause harm to an unborn baby if taken during pregnancy. Therefore, it is important for mothers who are breastfeeding and considering taking Xanax to speak to their doctor about any potential risks before doing so. Common side effects of Xanax in infants include sedation, respiratory depression, muscle weakness, decreased motor activity, poor feeding habits, and symptoms of withdrawal upon discontinuation. 4. Is it possible to breastfeed if you are prescribed large doses of Xanax? Unfortunately, there is no straightforward answer to this, as it depends on the individual woman and her circumstances. It is not recommended for women to take large doses of Xanax while breastfeeding, as the long-term effects of Xanax can pose risks to a baby. However, if a mother's doctor has prescribed her a large dose of Xanax and she wishes to continue breastfeeding, there are some precautions she should take. First, it is important that mothers keep their doctors informed about how much medication they are taking and whether they are breastfeeding. Mothers should also talk to their doctor about possible alternatives to Xanax or other medications, which may be safer for breastfeeding babies. Finally, mothers should ensure that the baby is closely monitored for signs of adverse reactions, including sleep disturbance and changes in feeding patterns. It is ultimately important that mothers discuss their options with their doctor before making a decision about whether to take Xanax while breastfeeding. Although difficult, it is possible for some women to breastfeed safely while taking large doses of this medication, provided they follow the advice given by their medical professional. By ensuring that proper precautions are taken, mothers can make sure that both themselves and their babies remain safe when taking Xanax. 5. Are there natural alternatives to Xanax that can be taken safely during breastfeeding? Yes, there are natural alternatives to Xanax that can be taken safely while breastfeeding. Some of these include herbs like chamomile and valerian root, as well as supplements like fiber and magnesium. However, it is important to consult with a qualified healthcare provider before taking any of these alternative treatments in order to make sure they interact safely with other medications that you may be taking. Additionally, when possible, it is generally preferable to choose dietary or lifestyle modifications over medication whenever possible. These can include things like getting adequate sleep, exercising regularly, practicing stress management techniques such as yoga or meditation, eating a healthy diet, and spending quality time with family and friends. 6. How long should a mother wait after taking a dose of medicine before breastfeeding her baby again? The amount of time you should wait after taking a dose of medicine before breastfeeding your baby again depends on the type of medication you are taking. For Xanax, it is generally recommended that mothers wait at least 2 hours before breastfeeding their babies once more. However, if you experience any drowsiness or other side effects from the medication such as dizziness or impaired coordination, it's best to wait longer than 2 hours. It's also important to discuss with your doctor how often and when you should take doses so that your milk supply isn't affected. Additionally, if there is an alternative to taking Xanax while breastfeeding that is safer for your baby, always follow the advice of your healthcare provider. 7. What should new moms do if they have concerns or questions about the medication they are taking while nursing their newborns? It is important for new moms to speak with their doctor or healthcare provider about any concerns they may have regarding the safety of taking Xanax while breastfeeding. A doctor or healthcare provider will be able to provide personalized advice and guidance based on an individual's medical history and current health status. New moms may also want to seek advice from a lactation consultant who can provide helpful tips on how to safely breastfeed while taking Xanax. Additionally, it is wise for new moms to consult with a mental health professional if they are experiencing any anxiety or depression that could potentially interfere with breastfeeding. Finally, it is important for new moms to keep up to date on the latest research regarding the safety of medications during breastfeeding. We hope this video has been helpful in understanding the safety of taking Xanax while breastfeeding. Remember to always consult with your physician before making any decisions about medication and diet, as every individual is different. If you have any further questions or concerns regarding safely breastfeeding while taking medications like Xanax, don't hesitate to leave a comment below. Be sure to subscribe for more videos on health topics that matter most to you. Thanks for watching.